Hello one and all, this is Dr. Jim Lowe with Tomlyn Veterinary Science, welcoming you to another episode of Facebook Live, where we're going to try to address as many questions as we can regarding the health and wellness of your dog and cat. Again, I'm the technical services veterinarian for Tomlyn. I was in private practice for 18 years prior to coming to work for Tomlyn. All the recommendations and thoughts I might have are based on that experience, but I please cannot emphasize enough that before you make any sort of change to the care of your animal, please consult your veterinarian who can best assess the current needs and health status of your animal and give you the best advice. So be sure you post questions as we move along, because I know in posting questions you'll be qualified for a drawing at the end of the chat that could win you some free product. So again, we're going to try to get to as many as we can. We already have quite a few, and we'll just go ahead and get started. The first question regards chocolate and whether chocolate is harmful to dogs and cats, and what one should do when addressed with the thought that they may have gotten into some. And the answer is yes on all accounts. It is very dangerous for dogs and cats. Certainly the milk chocolates tend to have less of the toxicity than some of the darker chocolates, but they both contain products called caffeine and theobromine, products that can cause cardiac problems, can cause seizures, and it can even cause liver failure. So if there's any question as to whether or not your animal ingested some, no matter how small an amount it might appear, please consult your veterinarian. They can best make a judgment call on how to proceed most efficaciously for the health of your animal. Along those same lines, there was a question about xylitol. Xylitol is a sugar substitute found in certain peanut butters, sugar-free gum, many things we buy now, and the question was, is that dangerous to dogs and cats? And it absolutely is. What xylitol does, though it is a sugar substitute, it still stimulates the same processes in animals, and what it causes is a huge release of sugar in the body. And so with the response to that sugar, the body releases insulin. And insulin is part of what the body does to lower blood sugar and keep blood sugar under control. But in dogs and cats, when exposed to xylitol, they have a massive amount of insulin released. So much insulin, in fact, that it drives their blood sugar dangerously low. So low that it can cause lethal hypoglycemia. It can also cause some liver problems, can cause seizures as well. So again, an emergency situation that's going to require you to contact your veterinarian because it is certainly something they're going to want to address as soon as possible. Then moving right along, we have a question here about taking a dog on a car ride for the first time, a long one, and there had some questions as far as restraining the animal in the car and other things they might want to consider before going on this trip. First and foremost, I'm a proponent that we try to confine our animal in some sort of crate. I think it is best for the safety of the driver, so we're not distracted with something going on because the animal's running around in the back seat. I think that crate should be also securely strapped in behind a seat belt so it's not rolling around should you have to unexpectedly hit the brakes. I know there are some restraint systems out there now that are pretty cool. I don't have a lot of experience with them, but certainly that is another way. They can make these harnesses very comfortable for these animals, custom fit them, and that would be another area to potentially to look at to restrain that animal. But a free roaming animal inside a car, because of the safety of the driver and the other occupants, I think is not a good idea. As far as the anxiety associated with that ride, I certainly think something like the Relax and Calm Chews that Tomlyn sells, containing chamomile, containing L-tryptophan, it's going to provide some calming, slight sedation. It's going to make that animal feel a little more comfortable in the car should they be a little nervous. I think placing them in their favorite crate with a toy or a blanket, again secured in the back seat as well, also makes them a lot more comfortable and should provide a smooth, comfortable ride for everyone involved. Next question about adopting a dog, and really I just had a question about leashes. There's a bazillion of them out there. My family personally, with our bulldog Biggie, uses a retractable leash. I think the retractable leash gives you a lot of freedom. You can let the thing out and give him plenty of room to run around, yet if you need to secure him much more closely to you, it works very well in that manner. So for me, I'm a retractable guy, but again, I think everybody has their opinions. I think it's good to stay consistent and get that animal as used to it as quickly as possible. Next question. Question about dog and cat's breath. This animals that always tend to have this bad breath, and certainly sometimes that breath can be associated with simply the diet they're on. Some animals tend to have a less good breath than others, and sometimes the diet can be an issue. You might discuss with your veterinarian if you suspect maybe that the diet is the problem. Certainly before you change the diet, you would want to have those discussions, but you also want that mouth evaluated fully. A full dental exam can oftentimes reveal inflamed gums, pockets of infection, plaque, and tartar that will contribute to that bad breath. And certainly sometimes a dental procedure is needed just to get a clean slate, to get everybody started on with a fresh set of teeth. Moving from then, you can potentially do something like our natural pet products, our homeopathic gum and teeth and gum treatment, where you place something in the water that's just going to promote a good, healthy oral cavity. There's lots of products out there like that. That's one we sell from the homeopathic side of things, and something to consider. But make sure that those teeth are checked out for any sort of pathology before we put them on some sort of prevention such as that. Let's see, what do we have now? Question about taking cats on walks. Have I ever heard of that or ever seen it? What do I recommend? And quite honestly, I have not really seen many cats on walks, and I think it is a rare cat indeed that's going to enjoy getting on a leash and going around. My concern would certainly be for their safety. Should dogs or less friendly cats be around. So I really have no experience. I know our cats never go outside. So I'm probably not the best source for that. I know there are some systems out there, and there are certainly some training that can be done with cats. But as far as them being outside, I just think it exposes them potentially to a lot of risks that may not be warranted. It also serves as a reminder, though, that exercise is important for our cats. We know now increasingly that cats suffer from the same types of osteoarthritis that dogs do, but cats are a little bit more stoic. They don't always show pain as much. They tend to not be as active. Many times they just lay around a lot more, but they do get osteoarthritis. We do need to promote exercise in these animals, and so playing with the toys, making sure you circulate those toys, always exposing them to something new and unique so they don't get bored, so they have to run around the house and improve that activity, is going to be important to keep those muscles strong, to keep that joint health adequate. And certainly Tomlyn does offer a joint and hip supplement for dogs and for cats that contains high levels of glucosamine and chondroitin, contains fish oils, which we know are supportive for inflammation. It also has MSM, which is another sort of analgesic. So joint supplements are very well documented need in cats, and we certainly offer one in a chewable form for those types of situations. Let's see. Another cat question regarding upper respiratory infections. A cat that was diagnosed with upper respiratory infections, and the owner was interested to know if lysine supplementation might be beneficial. Certainly it has been shown that lysine, which is an amino acid, does help in situations like that. And so potentially to support that respiratory infection, you might find that lysine support, our immune support chew, contains L-lysine and can be given as a treat. Very easy to give. We also have it in a powder for those cats that don't like treats. But lysine in some situations can certainly support the respiratory health of cats. Let's see. Another cat question, popular cats today, about taking pills, and it can be a daily battle, and it absolutely can. Even giving dogs sometimes can be problems, but especially with cats, we make a product called Pill Masker, and Pill Masker is just that. It's a little doughy treat that you can form around that pill. Masks that pill, and it makes it a lot easier to give that medication. You can even use it as a treat in between, so then the animal doesn't know really whether it's getting a treat or it's actually getting its medication. But the Pill Masker for Dogs and Cats by Tomlyn can be a huge help for us in situations like that. If we absolutely cannot give a pill to a cat, which is not uncommon, discuss with your veterinarian whether this medication can be delivered in some other form, as a liquid, or as a little flavored concoction, a compounded medication. Some medications can even be given transdermally, where we just rub it on the inside of the ear, and it can be absorbed through the skin. So there are potentially other options to give medications, and your veterinarian can best help you make the right decisions as far as how to best treat your animal. Another question regarding cats and hairballs. Owners a little bit tired of the hairballs. Are there things we can do to prevent them? Are there steps that can be taken? Certainly the object with the hairballs is to allow them to pass through the GI tract and be deposited in the litter box. The hairball remedy by Tomlyn does just that. It binds it up, oils it up, keeps it in a ball, and allows it to be passed in the litter box instead of out in the middle of the kitchen floor. And so a supplementation like that is certainly warranted. Frequent grooming on these long-haired cats to try to keep that hair under control as best you can is another way to potentially ease some of these concerns with hairballs. Your veterinarian can have other recommendations. There are diets now out there that purport to support hairball control. That might be an option that in consultation with them you decide. But certainly hygiene, brushing, the hairball remedy are all good steps in the right direction as far as that. Have some questions being posted. Best suggestion to get two dogs to get along better. They're both males and they're about 5 years apart in age. That can be very difficult, and many times that's going to take probably some professional training to help you. Sometimes a product like the Relax and Calm can ease some of those anxieties, but it's really hard to tell because there can be a lot of different reasons why these two dogs choose not to get along. Could it be territorial? Is it simply their age difference? There's just a lot of things going on there. So I would say consult with a trained behaviorist or a trained dog trainer, a professional dog trainer, and get some help, because certainly it's probably going to involve you as the handler as well. Because many times just to train the dog and not to train the owners or the handlers is only covering half the problem. So see what you can find out, and again, if we can add some supplementation along the way to maybe ease some of that anxiety, that may also be beneficial as well. Let's see here. Looks like we had a question here about service dogs and keeping them in tip-top shape. Certainly the service dogs fill a huge need in this world, and we really want to make sure we take optimum care of them. Certainly nutrition is going to be huge on the list, and again, your veterinarian can give you the best recommendations to make sure all of their daily requirements are met and exceeded, because many of these animals are working much more actively, much more strenuously than your average house dog is. So certainly exercise, absolutely. Exercise plans and programs to keep their muscles fit, to keep them in tip-top shape, need to be lined out and discipline practiced in exercising them every day. We certainly know these animals are going to have increased strains on their muscles and bones and joints. So again, our joint and hip product might absolutely be indicated. High levels of glucosamine and chondroitin, the omega-3 fatty acids for comfort, MSM is also going to be important as a support for discomfort, but a joint supplement, even before they have major indications of osteoarthritic changes, is certainly going to be something that will be beneficial as they move along and as they age. Swimming is also a very good exercise if these animals have access to areas where they can work. Low impact, low stress on the joints, and another good opportunity there, again, to keep those muscles toned. And in strong muscles, we also get a lot of joint support as far as that's concerned. Let's see here. I'm checking to see if we have anything else. Well, that's about all we have for right now. Again, we'll be chatting again next month. Feel free at any point to address... Oh, hang on, one just came in. Question about... very good. Talking about service dogs again. And again, I know from personal experience the benefits of service dogs, so certainly appreciate all those out there that are supporting our service dogs and and using them to help others. It's greatly appreciated. So again, we'll chat next month again. Feel free always to go to the Facebook page, post your comments, post other questions. We'll try to get to them next time, but really do appreciate it. And again, I think those winners should be announced very shortly for those that might be lucky enough to win some free product. But again, my name is Jim Lowe, Tomlyn Veterinary Science. This has been Facebook Live. We do appreciate it. We'll talk to you next month.